Hello, doctors. If you've ever felt like navigating the prior authorization process is a puzzle, especially when it comes to specialized devices like the Dexcom G7 sensors, you're not alone. These continuous glucose monitoring systems are game changers for managing diabetes, but getting that green light from insurance? That's a whole different challenge. Don't worry, though, because today, we're simplifying the entire process just for you. Let's talk step by step about submitting a prior authorization for Dexcom G7 sensors, ensuring smooth processing and approval every time. Whether you're a healthcare provider working directly with patients or part of an outsourced support team managing this process behind the scenes, this guide has got you covered. First things first, gathering the patient's details. Double-check the basics: full name, date of birth, and member ID from the insurance card. It may sound simple, but a single typo here can lead to unnecessary delays. Don't forget to confirm the diagnosis code. For Dexcom G7 sensors, a common one is type 1 diabetes mellitus without complications, ICD-10 code E10.9. Accuracy is key. Next up, verifying patient eligibility. Log into the insurance portal, whether it's OptumRx or another payer platform, and input the patient's member ID and date of birth. If the system doesn't recognize the patient, try a few tricks. Remove any hyphens, double-check for outdated IDs, or even confirm spelling variations. Once you've got eligibility locked down, you're ready to move forward. Now it's time to initiate the prior authorization request. Navigate to the prior authorization section in the portal, select the right plan, and make sure you've got all the prescription details handy. For Dexcom G7, you'll typically be entering a 30-day supply with usage noted every 10 days. Upload supporting documentation like diagnosis codes and clinical notes to back up the request. If you hit a roadblock, like the medication not appearing in the portal, check the plan's specific coverage for Dexcom G7 sensors. Sometimes, it's just a matter of finding the right category. Here's where supporting clinical information comes into play. Attach recent office visit notes that highlight the patient's diabetes diagnosis and their need for continuous glucose monitoring. If the patient has used previous Dexcom devices, like the G6, include those reports as well. Showing prior success or the necessity for an upgrade strengthens your case. You might also need to answer clinical questions within the portal. This typically involves listing any previous medications or monitoring systems the patient has used, and explaining why they didn't work. It's your chance to emphasize the importance of transitioning to Dexcom G7 sensors for better glucose management and patient safety. Finally, it's time to review, upload, and submit everything. Double-check every field to avoid mistakes, then hit that submit button. After submission, keep a close eye on the portal for updates. If you run into denials or requests for more information, reach out to the insurance provider promptly to resolve any issues. And there you have it, your complete roadmap to managing prior authorizations for Dexcom G7 sensors. Streamlining this process not only saves you time but ensures your patients get the care they deserve without unnecessary delays. Before we wrap up, a quick reminder: if you're looking for ways to reduce the burden of prior authorizations or streamline your healthcare operations, Staffingly's expert outsourcing services are here to help. From medical billing to clinical support, we make it easier for you to focus on patient care. Thank you so much for watching. If you found this guide helpful, make sure to like this video, subscribe to the channel, and follow us for more healthcare tips and outsourcing solutions.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.